Welcome, listeners, to another enlightening episode of the Pathways to Prevention podcast, where we explore the roads less traveled in the fight against substance misuse and illuminate the stories of those who guide us along the way. I'm your host, Dave Clausen, and today we have a very special episode that promises to inspire, educate, and perhaps even challenge some of our preconceived notions about drug prevention and the people who dedicate their lives to this cause. Today, we're joined by a remarkable individual whose journey into the world of drug prevention was as unexpected as it has been impactful. She's someone who, by her own admission, didn't set out on this path initially, but has since become a beacon of hope and a pillar of strength in the community. I'm talking about none other than Amy Ronshausen, the Executive Director of the Drug-Free America Foundation. Amy's story is not just about the transition from a humanities graduate to a leading figure in drug prevention. It's a testament to the power of personal experiences, the importance of mentorship, and the profound impact one can make by stepping through the doors of opportunity, even when they lead into the unknown. So whether you're a professional in the field of prevention, someone passionate about making a difference, or simply curious about the paths life can take us on, this episode is for you. So join us as we dive into Amy's journey, the lessons learned along the way, and the work being done at the Drug-Free America Foundation. Without further ado, let's welcome Amy to the show. Amy, thank you so much for joining us today.
Thank you for having me, Dave.
I always love it when we can get together and chat all things prevention and Drug-Free America Foundation. Y'all always have so much going on, doing such awesome work across the globe. But I know not everybody has really had a chance to get to know you as an individual. What do you say we start there with this episode and tell us a little bit about yourself? How did you end up in your role as executive director?
Well, probably not the way that most people would think. This isn't what I plan to do with my life. I graduated from University of South Florida with a degree in humanities. So if anybody wants to try to beat me at Trivial Pursuit, I'm on, but that's about as the only thing that degree is good for. And I didn't really have a real job, per se. I was just kind of, doing whatever after college. And when I got engaged, I realized I needed to, buckle down and get a real job. And I had a couple friends at the time worked at one of our local treatment centers here in the call center. And basically, community people would call in and, seek services. And you did almost like a mini biopsychosocial over the phone with them, and then you connected them with whatever service that was needed. And so I kind of started there, and I really liked it. And I had a really great boss by the name of Wendy Danacourt, who is now one of my very good friends and also on the Drug-Free America board. And so she was my boss, and she just kind of pushed me to continue in this field. And encouraged me to move to adult drug court after I worked at the treatment center, and I was there for a few years. And then eventually I got a call from the Drug-Free America office because I knew somebody that worked there, and met with Calvina, our former executive director, and I guess the rest is history. But it was one of those things where, if you asked me what I was going to do with my life, so I was going to be a ballerina, I was going to be an archaeologist, I was, something else. And then this door opened, and at the time, I think I walked through it because growing up, my sister had some issues, and I saw what my family went through and what I went through with that. And so when I first came into this, it really was from a perspective of how can I help other parents so that they know what kind of resources to seek and what to do when they have a child that's going through some kind of substance abuse issue. But then as I learned more, it kind of opened my eyes to what my sister was going through and maybe the reasons why she made some of those choices and the struggles that she must have had. And I kind of stayed to help people that might have been in her shoes. So it was kind of like a really weird entry into this world, but I've stayed here because I see how this just impacts almost every area of everybody's life. And I meet the best people. I mean, we have such wonderful colleagues and such great global partners that, even though the topics sometimes are a little depressing and it's not a job where you're getting all kinds of accolades and people are throwing you parties, but you're meeting the best people and you're making a difference along the way. So it's worth it.
I'll second that. Absolutely worth it. And I love how we all have our unique pathways to prevention. But up bump. But you kind of took me back to when you said that door was open and you stepped through that door into this role, this work, our organization. What was that experience like when you stepped through that so-called door?
It was eye-opening. I mean, I'm somebody who, this is your brain on drugs worked for me. The fact that I would have disappointed my parents or possibly gotten into legal trouble if I would have used drugs was enough for me. So I, was not a rule breaker, and I really didn't know a lot outside of the fact that I knew my sister was dabbling in some stuff. I didn't know a lot about this world. And so I have to say it was a little sad at first. It was, sitting in a call center and the phone rang nonstop with people seeking treatment and help. And so on one hand, you had the reward that you were connecting people and helping people, but at the same time, it really opened my eyes, and I was probably very naive to this. And this was, I'm 50 years old, so this was, almost 30 years ago, that this was out there. That so many people were needing help and that so many families were affected. And at the beginning, it was hard to disconnect from that. I would come home worried about the guy that I couldn't get a bed at detox, or the kid that ran out of my assessment and, were they going to come back? Or I heard somebody got arrested. So I kind of were taking those to heart as, did I fail, or what's going to happen with those people? And I think, now I still have all that, and you're still wondering, are you pointing everybody in the right direction? Are you doing everything that you can? But now just to know that there's so many other resources out there and there's so many other people working on the issues, it helps. But it was definitely, that first step through the door was definitely a shock for me. Not being somebody who was in that world and being somebody who was probably very naive to the world around her.
I could feel the emotion, the challenge of taking those heavy calls and carrying that emotional weight with you after work.
Yeah.
And I know many of our listeners have and likely still do experience that same challenge working in our field. What are a couple, lessons learned or tips that you might offer them?
Oh, well, I think probably the biggest one that I learned, and I think a lot of people in this field probably can relate to this, is because we're so passionate about what we do, we sometimes don't roll with the resistance. So, having a person come in who, especially when I was in the treatment end of it, most of the time they didn't want to be there. They were there because of a reason. And, whether or not the court was telling them they needed to be there, or a parent was telling them they needed to be there, or a loved one, the majority of the time it wasn't their choice. And so they came in kind of kicking and screaming and very guards up, very resistant. And so kind of like just acknowledging that and finally understanding where they're coming from and just rolling with it and continuing on, and not getting emotional about it, not getting deterred from what the goal is. And then, finally seeing them coming around, whether it be within that session or 3 weeks later or a year later, grateful that they had the opportunity and that they were able to complete the treatment, or that they were able to be unified with their family, or, whatever it was, that they were able to get a house back, to get their driver's license back, to graduate from high school and get their GED, whatever that they were able to accomplish because they did take that first step, and you didn't let them fight you about it. Because that's what they wanted to do. They wanted you to get mad so that you kicked them out of the office and that they didn't have to kind of go, right? And many a times that's what you wanted to do. You wanted to push back. You wanted to give them that reaction that they were probably looking for. But by doing something else and being compassionate and just letting them be, kind of helped.
It's probably almost like a reflex at first, wanting to, hey, no, don't do that, and push back. Just gotta resist that reflex. And what I heard too, or to put in my own words, was acceptance. Accepting them where they're at, and also sort of internally accepting that you can't make them change, that it's always going to be up to them, and just accepting that fact.
Yeah. And that one, I think probably honestly was hard for me. Being somebody who was not the rule breaker and not the risk taker, it took me a while to understand. And honestly, I probably held some resentment, from what my sister put us through growing up, and my parents, because I didn't understand. I didn't know that addiction was a disease. I didn't know that she didn't really have a choice, to not do the things that she was doing, and that she was doing them for other reasons. And so, and I think that for me, it happened in a certain part of my life because I was still younger then. This was my first professional kind of job. So for me, it was kind of accepting each client that walked through the door and not seeing them as an addict, seeing them as a person, and seeing them as a person that has a chronic relapsing disease and somebody that deserves all the resources and help and compassion that I can give them. To be honest, it wasn't there at first. So that took me a minute. And then once I got that, it just kind of all clicked. And then I saw, how easy. And I remember I used to work in drug court, and there was a woman that graduated from drug court, and she was probably in her late 60s, and she had lost everything. She at one point had, she was a business owner. She had a big house. She had a wonderful family. She had nothing when she graduated from drug court. She was homeless. She didn't have a job, but she was sober. And I realized then that any one of us are just one choice away from that happening to us. And it's not the choice to pick up the drug or to take the drink. It could be the choice to have dinner with somebody who is going to start influencing your personality to be down this path, or the choice not to address some of the issues in your life that need to be addressed that are going to make you make these toxic choices. And I just really saw in her how this could happen to anybody. and how easily it could happen to anybody and how much work she put in. And I just felt like she was a superhero at the time. Like she had just done so much to get her life back. And I thought, seeing this and being here to clap for this lady, this is where it's at. Like this is the good stuff.
Mm-hmm. Oh, yes. And can we just live in those moments and lift up and share all of those clapping moments? And I like how you articulated, one choice, and it's not going to be necessarily that clear cut. This is a good choice. This is a bad choice. And took me right back to really early when I was working towards sobriety, towards recovery. And the way I kind of framed it for myself was I needed to get better at identifying the slippery slopes and then staying far away from them. Because those slippery slopes look like so many different things.
Yeah.
Yeah.
And they're different for everybody. Yeah.
Absolutely. And yeah, I'm curious though, now treatment, got the family experience there, sort of driving your work as well, drug courts. How do those experiences shape or influence the work you do now in prevention?
So it really kind of, it all came down to policy, to tell you the truth. When I got the call from Drug Free America Foundation, I was still working in drug court, and I loved drug court. Like I loved the experience. I loved the purpose of it. I just enjoyed it every day. And I probably would have just sat there forever. And we just happened to have a case where the defendant didn't have that the state attorney's office was basically dropping the charges on the defendant because there wasn't enough trace evidence in the pipe to charge her with possession. And without a possession charge, she couldn't be in drug court because that was her only charge. But she was begging at the podium to remain in drug court so that she could have access to treatment. And so I looked at the state attorney and I said, can't we just, she's admitting that she used the drugs. Can't we just charge her with drug use? And the state attorney said, it's not illegal to use drugs. It's only illegal to possess drugs. And so she, we don't have anything to charge her with. We have to cut her loose. And this woman left crying because without that criminal charge, she did not have access to treatment in our community because she didn't have insurance and she couldn't self-pay.
Yeah.
I go into the office, I get the call from Drug Free America, and and it was a policy job. It was to work in can't remember what it was called. It was some fancy title, like, manager of congressional and legislative affairs. And I was like, oh, wow. But I thought to myself, like, God put this here for me. I'm complaining about a policy that I can't change. And now somebody is giving me the opportunity to work in policy. And I don't know what that means. I don't even know how a bill becomes a law. But I feel like this was put here purposefully. So I have to take it. And I did. And Calvina taught me all there was to know about reading policy and how a bill becomes a law. And when I think I know it all, everything changes. But it really instilled in me a passion for policy and a passion for that part of our prevention work. And so policy remains a very big part of the Drug Free America portfolio on how we look at prevention, not just as educational campaigns, but as the choices that we make every day in life that are influenced by the policies that are put in place, whether they be at the global, national, or local level.
I want to put you on the spot. Can you hit us with an example?
Sure. I'll give you a personal example of policy that works. And anybody who's ever listened to any of my webinars or heard me speak on policy and advocacy has probably heard this before, but I think it's a great example. So back when I was in going to college, there was no such thing as tobacco-free campuses or smoke-free campuses. And I had never smoked in my life. Like I might have tried a cigarette here or there in high school, but I didn't like it. I wasn't a smoker, and I just didn't smoke. Wasn't my thing. But I drove to junior college. Back then it was the St. Pete Junior College. Now it's the St. Petersburg College. But I drove to college and I got on campus and I'm walking through my first day of what I referred to as 13th grade. And I see everybody on campus smoking and they looked kind of cool. So the next day I stopped at 7-Eleven on my way to a campus and I picked up a pack of Camel Special Light. Don't ask me why I picked those. They just looked kind of cool at the time. They had this like psychedelic campaign that was part of their packaging. So I bought the cigarettes. I go back to my truck. I realize I don't have a lighter because I don't smoke, right? So I have to go back to 7-Eleven. I have to buy a lighter, get back in the car, head out to campus. I light up my cigarette. Tastes disgusting as it did the first time that I tried it. And I actually just kind of felt sick and had this gross taste in my mouth the rest of the day. And I ended up going home from college early. But I would have never made that choice if the policy in place was that this was a tobacco-free campus or a smoke-free campus. So that is an example of how policies impact the decisions that we make every day. And thankfully, I hated it because my dad and my sister at the time, they both smoked. My dad has been off of cigarettes for quite some time, over a decade now, I believe. And so it probably was in my genes to be a smoker. But I'm glad that I didn't like it. But that's a path I would have never even contemplated had that been a smoke-free campus when I walked on. So that's just an example of how these policies really do, and you don't even realize it until you've made the decision.
Policy. I gotta say, there's not a ton of folks that I've met that say they love policy.
No, neither.
Yes. There's so much behind them. Yes. Like we could do a whole podcast series unpacking policy.
Well,
wonderful example. Yeah, go ahead.
I think one of the big things with policy is it scares people because people think policy, that means I have to talk to my legislator. That means I have to talk to somebody in power and I'm not good enough for that. But the reality is all of us working on the ground and at the community level are the experts when it comes to these issues. And all they're doing is putting pen to paper and actually writing the legal statute. But you're telling them why it's needed. And because there's been plenty of sessions I've been in and you say, we're going to talk about policy and all of a sudden you can hear a pin drop. You know, everybody's afraid that they're going to get called on. They're hiding behind the tables. But I will tell you, once you engage somebody in policy and once you guide them through looking at legislation and finding loopholes, they become really good at it and they see how easy it is, but also how engaging it is. And, I have to shout out in case any of them are ever listening. My people in Kentucky are great at policy. And they look at legislation, they find all the different loopholes and how that's going to impact their community. And then they provide their lawmakers with sourced talking points, educational talking points on the impacts of these policies and why they need to be changed. And, of course, we do that here in Florida where our home base is. But there, a good portion of coalition work is around policy and education. And there are quite many of them throughout the U.S. that are doing a really great job at that. And I just don't think a lot of people understand that that's part of prevention work.
And listeners, you heard it. Policy might make you cringe or tense up, but your voice matters. your voice is ever so important. So speak up and share your voice. It's okay. It's okay.
Absolutely.
Yeah. I want to continue down this journey that we're on together. And, when you step through that door, Drug Free America Foundation, policy, but now in your role as executive director, what all you got going on?
Oh, we've got a lot going on.
Is your head spinning right now thinking of the list?
Yeah, it is. And you probably could ask some of my amazing coworkers and staff, and they might answer better than I would on this. But I think that we're always changing. And just when I figure out what our focus is and the things we're doing, we seem to pivot. But I think that that's because this world changes so fast in what is needed. I mean, even when we're speaking about education, sometimes it's education on the harms of drugs or what the current drugs are that are out there. And then it's, who are you educating? Are you educating potential users? Are you educating family members? Are you educating grandparents? Like, it just never stops who your audience is, because it's everybody today. So you have to be able to change that message and make it relevant to all these different groups that you're talking about on all these different issues. So education is always a big part of it. And we have a couple different campaigns going on now. In Florida, we have a big campaign to reduce marijuana use during pregnancy and postpartum. We're on our second year of that, doing a lot of stuff through that grant. Then, of course, we're always looking at the marijuana issue and how that is always changing, and the high potency products and their impact to mental health, and working on a campaign in Illinois to highlight those issues, and then also to prevent marijuana use by youth, looking at a statewide campaign in Illinois that's going to be coming out in the next, I think, few weeks. So rolling that out soon. We have our prevention summit that's coming up, which is one of our big events to help professionalize and do professional trainings for the workforce in our industry. And not only an opportunity for us to provide education to all of our peers out there, but an opportunity for us to be educated by all of the amazing global experts that we're able to bring in for that. We have our international work that comes to a head each year in March at the Commission on Narcotic Drugs. So a lot going on with that. And it just keeps going. I mean, just that's taking us to March. So just a lot of more things going on, and trying to figure out, how we can be relevant here at the local level, but also continue to provide resources and be relevant at the global level. So it's always tricky, and it's always wearing a lot of hats, and it's spinning a lot of things all at once. But I think that, when this is your thing, you just can't say no to any kind of opportunities that come along that might better our local or global community. So I don't think any of us in this field would say we're bored. We don't have something to do.
Oh, yes, indeed. I want to talk about the summit because I'm excited about it. But first, the power of the pivot. Always observing, always watching and seeing how the world, the landscape is evolving, and being able to adjust course. I feel like that is something, that conversation alone could bring so much value to our listeners, because even at the very local community coalition level, things are always changing, always evolving, clear up to the state, national, and global levels as well. So what might be some words of wisdom that you could share with us on how we could better pivot, know when to pivot, know where, know how to pivot?
I think it's just being aware and looking at things that are, the news articles, what you see in your community, what people are asking for, listening to the youth. They find out things a lot faster than we do. making sure that we're listening to them and hearing what they're saying so that we know when we might need to start changing our messaging from, just talking about the impacts of drug use to maybe talking about mental health. Making sure that that prevention isn't just about why drugs are harmful, but it's also about building protective factors and reducing risk factors. And those are terms that we probably throw around without thinking about what that means. But how you can do that in your everyday life kind of thing. But I think, also just being aware of, especially now in the age of marijuana, where that's such a big thing now, just driving down the street in your neighborhood, keeping your eyes open to what are all these signs saying? What are they promoting? And are you working to impact that? I was visiting a friend last year, and she lives in Washington, probably about 45 minutes above Seattle. And I was thinking to myself, because I'm in St. Petersburg, Florida, I've got everything at the tip of my fingertips. I can go to Target, I can go to TJ Maxx, I can go to the grocery store all within 5 seconds. And I'm thinking, where does she get her groceries? Like, where does she do this? And we were driving around. She took me on this nice drive, and I'm looking at things. And so I said to her, where do you grocery shop? And she goes, well, I could go 40 minutes to this grocery store, or I could go to a couple different little places and get what I need. I said, okay. How many libraries are here? And she's like, oh, I think there's one at the high school. I said, oh, I'm just looking around, where are the bookstores? Where are those things? Where's the childcare centers? And she's like, oh, there's one here, one there. And she's like, why are you asking all these questions? I said, because in the last 15 minutes, we passed 6 pot shops. So what is the priority in this community? It's not education. It's not libraries. It's not food security. It's making sure that you guys are getting your marijuana. And, what are they doing? So if you can notice those things, then being aware of how not just seeing that there's 6 pot shops, but then really thinking, how is that impacting this community? What message is that sending to the kids that live in that community, that they're never more than 100 feet away from a pot shop, but if they want to get fresh groceries, they've got to drive for 40 minutes. So thinking about how those things impact our communities, and really that's just making sure that you always have your eyes open and that you're not becoming blind to these things when they're everywhere.
Keep your eyes open, keep your ears open, and always be learning and observing.
Yes.
And I'm going to actually use that as a segue to let's talk about the summit, because that's another great place to hear from experts to learn about what is going on. Where do we need to maybe pivot or change or shift focus?
Yeah. And the summit has made a lot of pivots itself, I have to say. This is our 11th year. Yeah. This is our 11th year. And we started off partnering with the Hillsborough County Anti-Drug Alliance, our great friends across the Bay in Tampa. And it started off 11 years ago as a one-day marijuana summit. And then a couple years later, it turned into a one-day marijuana summit, one-day opioid summit. And here we are 11 years later, and I just can't make enough training. I could probably plan a 3-week summit if we wanted to, because we just have so many great topics, and we try to really make sure that our topics now span the continuum of care, so that we really are looking at prevention, evidence-based harm reduction strategies, increasing access to treatment and care, and promoting sustained recovery. So having, if you would have told me 11 years ago that I would be hosting a summit where I might have a harm reduction session in there, I probably would have thought you were nuts. But, following the data and following the science and looking at the things that are evidence-based and that are working in our communities and educating ourselves. And, I just, one of the things I like best about our summit is when somebody comes back the next year and they say, Oh, well, after your summit, I went home and our coalition decided to host a half day conference on some of these other issues, or we did a PSA on this issue, or we brought in that speaker to come talk to us. So, those little things mean that to me that we're really giving the audience what they're looking for, and that it's fresh, new material. And even when we bring in some of the same speakers year after year, we try to change it up, but some people are just really good, but they're talking on different topics and it's new data. So we're really excited. This year we have 2.5 days. So the first 2 days are our regular drug summit days. And then we have a half day on the third day that's sponsored by CCA. And that is for the Florida coalitions, although anybody's welcome to join. And we use that as a strategy session on, we look at what we did last year, the challenges and successes that we had, and what are we going to do for the rest of the year, and what are our goals. And just also as a networking, a chance to come together, because we don't often get to do that in the state of Florida. It's very big. And hear what each other's doing and things that we can replicate and learn from each other on. And then this year, we just keep adding things as if we don't have enough to do. This year, we have a special track devoted to reducing substance use during pregnancy and postpartum. So we have 3 different speakers who are going to address that. We also have a closing keynote by Bertha Madraz from Harvard Medical, and I know she'll touch on that as well. And then that evening, she will join us for what we're calling a community town hall / fireside chat, where we'll have a small panel of some national and local experts on these issues to talk about that issue. And it'll be moderated by the Secretariat General of World Federation Against Drugs. Our friend Regina Mattsson from Sweden is coming in to do that. So we're really excited. And then on day 2, after the summit, if people want to hang around, we're opening it up to the public and doing an overdose prevention training, where we'll actually have a training on how to recognize an overdose, how to reverse an overdose, and then all the participants will leave with a supply of Narcan or naloxone. So it will be a lot this year, a lot of different things going on. So we're super excited, and we'll probably need a good rest afterwards.
I'm just trying to mentally track. So this is going to be a conference. There's also an overdose response training attached to it. Then there's also the coalition meeting as well attached. So you're getting like 3 events in one. Okay.
Yeah.
Okay. Is that it? What did I leave off that list? Because there's a lot y'all are doing.
Well, there's the fireside chat on the reducing use during pregnancy and postpartum. We also have a welcome reception that's being sponsored by Cove Behavioral Health, and that's something new this year. So we're feeding you, we're teaching you, and we're hoping to spend time with you while you're there. So it's a lot.
Yes, it is. Can folks still register, by the way?
Yes, registration is still open, and we'll probably close that at the end of next week. So probably on the 15th or 16th. But registration is still open. We are sold out on vendor tables, but we do still have, last minute sponsorships available if anybody wants to do that. But really just trying to bring in a few more people. We have a great crowd so far. We've got people coming from a few different states and a few different countries.
I'd say, a few different countries as well. Last question about the summit, I think. Fun thing about being a host is you can just keep asking questions anyways. Who might be one of the speakers that you personally are really looking forward to seeing?
Well, of course, you. No.
Yes. Yes.
You win. No, well, so that is a hard one. And I'm going to save myself by saying I really was looking forward to seeing Tom Brown from the Colombo Plan, but unfortunately, he just had to bow out. And he's totally fine and everything is okay. He's just not going to be able to make it. But he was going to speak on the fentanyls and the xylazines and the new additives. And if anybody's ever heard Tom Brown speak on this, he is the master of explaining all of the things that are in all of these drugs and where they came from. And somehow he's masterfully tracked it from production to sale and all the stops along the way. And it's just, sometimes really over my head, but so interesting to hear. And we're just kind of devastated that I don't get to hear this presentation. But Tom has agreed to do a webinar for us on it. So we're looking forward to that in the next couple months. But besides that, I am also really just looking forward to the different topics that we have. I'm really excited that this year we have quite a few speakers on recovery. And I think that, like I said about the lady in drug court, how I just felt that she was a superhero for everything that she overcame. I think that, when I first started in this field, we didn't talk about recovery because everything was anonymous. And I think that played a big part in stigmatizing drug use, because if it was anonymous, then they weren't real people. We didn't know who they were. And now we know who everybody is. We know who most of these people are, and we know that they're us. They're our family, they're our friends, they're our neighbors. And so I'm just really excited that we have 3 or 4 different speakers who are going to speak on different aspects of recovery, including our opening keynote, Dave Hyman, who I know has done the podcast, and the first 100 people get his book that come, and I've read it and it's amazing. I mean, it's a great book, but it's hard. It's hard to read because it's his story, and his story has some really dark thoughts in it that you are just so, you feel for this child that went through these things, but then I can get through it because I know the adult that he is now. And so it's super cool to read the book, but for me, it was a little hard at some points because you just get so upset that this child felt these things and went through these things. But so I'm excited to hear all of them. You're probably going to get me in trouble with some speakers that I didn't mention, but I just am excited to hear all of them.
I've got some big shoes to fill. The slot I stepped into. Oy, oy, oy. No. I'm looking forward to meeting Dave as well. I just clicked. We connected during his podcast interview, and I've just been looking forward to an opportunity to actually connect with him in person. So I'm looking forward to that. And yeah, so plug for my session actually. I don't know if I can do that or not, but
yes, please.
So I'm going to be sharing my journey from combat to recovery to really talk about how you all can integrate lessons learned from my combat experience and my recovery journey into your prevention work and your treatment and recovery supports as well. And I like to challenge myself. It's going to be tough for me to do this presentation because sharing some of those big pivotal yet dark moments in my journey too. But it's important to share your voice, your journeys, my voice, my story, so others know that there is hope.
Absolutely. And I'm looking forward to yours too. And I feel like it really will be impactful, especially for the coalitions that are in the Tampa Bay area, because here in Tampa Bay, we're home to MacDill Air Force Base. And so we have a lot of veterans here in our community. And I think that, your story and these kind of things are what we need to learn, because these are the people that surround us every day. And the more that we can understand their situation and understand what they're going through, helps us be a resource for them and helps us understand them. And so I think that that is, definitely something that was missing on our agenda and can very much be an asset to people that are attending to hear.
I'm pumped to have the opportunity to share. I am. I love every chance I can. I get so grateful. We've been chatting for quite a while, surprisingly. I thought this was going to be a quick episode. All right, folks, check the show notes for links. Get registered to attend the annual summit because we got to meet there in person. Would love to see you. Would love to connect. Would love to grab a selfie for social or something along those lines. Also, stay tuned for the upcoming webinar that Thomas is going to do since he's unable to attend in person. And I would think that y'all have been to the Drug Free America Foundation website and seen the plethora of resources galore. So much information there. I would encourage you all to jump on there, and yeah, you'll just be blown away by all of the great resources there. Before we hit stop record though, Amy, what other sort of topics or final words of wisdom would you like to share with us?
That's always the loaded question, right? You're ready to do one of these podcasts and it come with a little caveat that says, don't forget at the end, you're going to have some great words of wisdom to share with everybody.
Right.
So I don't know. I would say, just really, I'm grateful for all of the people out there doing this work every single day. And I know that I need it sometimes, so let me give it to you. Keep going. What you're doing is making a difference. It might not feel like it every single day, but at the end of your career, if you were able to help just one person, and you'll probably never even know about that person, but if you were able to help that one person, it was a career and a life choice worth making. So just remember that on the days where it feels like everything is against you and you're a lone wolf in this fight to protect people from the harms of substance abuse in our communities and around the globe. So keep it up. And if you need a shoulder to cry on, Drug Free America's here. If you need somebody to cheer you on or join you in your fight, we're here as well.
Wonderful. And with that, thank you. And I will see you in 2 weeks.
Yes. Week and a half.
Indeed.
Yes.
Week and a half. I'm not good at math. All right. I'll see you there at the summit. Listeners, hope to see you there as well. Thank you all very much and keep rocking. That concludes this episode. Thanks for tuning in. Be sure to hit the subscribe button and share this episode with a friend before you leave. And we look forward to seeing you on social media because prevention is better together. Together, we are stronger.